hygiene, providing privacy. Hi, my name is Cindy. I'm going to be your nurse this afternoon. Can I have your name and your date of birth?
Marco Parducci, 52664.
Wonderful. And Marco, do you have any allergies?
Only the Olive Garden.
Olive Garden?
Yeah.
What happens
I go
when
to
you go?
shop. Well, I'm Italian and I don't eat that shit. So
So what happens when you go to
I
the
die.
Olive?
I die. My throat swells up. Says, how could you do
Okay,
that to me?
so you've never been to the Olive Garden, I
No.
take it. Okay, all right. I'll make sure you never go there.
Okay.
Okay, and are you in any pain today?
No, I
No.
didn't eat at the Olive Garden, so I'm feeling good.
Okay, wonderful. And do I have your consent to do head, face, nose, eyes, ears, mouth, and throat assessment with you
Yep.
today? Okay.
This is my service dog. It's my comfort animal.
Okay, great. Thank you
Okay.
for bringing him in
Well,
today.
you know, I need a lot of comfort.
Okay. Okay, great. So the first thing I'm going to do is I am going to inspect Marco's head. And as I'm looking at Marco's head, I see that it does not have any masses or lesions or infestations. And Marco, is it okay if I palpate your head right
Sure.
now? Okay. And again, I'm not palpating any masses or any lesions or any deformities. And next I'm looking at Marco's face, and I see that his face is symmetric. I don't see any abnormalities. Marco, I'm going to have you smile, puff out your cheeks. I'm going to have you raise your eyebrows. And so Marco has even movements, symmetric movements. Right side of his face matches the left side of his face. That's beautiful. Next, I'm looking at Marco's neck. And Marco, if you could touch your neck to your chin, to your chest, okay, and look up towards the ceiling. That's great. I don't see any masses. I don't see any lesions at all. I don't see any abnormalities. That's also great. Next, I'm going to have Marco take off his eyeglasses. And I'm going to take a look at his eyes. And I don't see any lesions of his outer structure of his eyes. I'm looking at his eyebrows. I'm looking at his upper lids. I'm looking at his lower lids. I don't see any lesions. I don't see any redness. I don't see any drainage. Marco, if you could pull down your lower lids. I'm looking at his conjunctiva. It is clear, it is moist, it is pink. I'm looking at his sclera. It is china white. Next, Marco, I'm going to check pupillary response. So I'm going to shine a light on your pupil. And it's going to feel a little bit uncomfortable, but I'm just going to be checking for pupillary response. Okay. So as I'm looking at Marco's pupils, I see that they are equal, they are round, they both react to light. And now, Marco, I'm going to have you focus on the tip of my pen here. And I just want you not to move your head, just to focus on the tip here. I'm going to bring it close to you. And I'm going to bring it far away. And I see that Marco's eyes converge and his pupils constrict as I bring it close. And as I move it away, his pupils dilate. So that's excellent. Next, I'm looking at Marco's nose. It is symmetric. It is proportionate to his face. If you could tilt your head up. Looking inside, I don't see any drainage. I don't see any redness. I don't see any deformities. I don't see any signs of a deviated septum. That's also excellent. Next, I'm looking at Marco's ears. I'm looking at the outer structure of Marco's ears. They look equal to each other. I don't see any redness. I don't see any lesions. I don't see any drainage. I'm going to look on the inside auditory canal. Again, I don't see any redness. I don't see any drainage. I don't see any lesions. Marco, I'm just going to test your hearing, and I want you to cover your left ear for me. And I'm going to whisper a word.
Pizza.
Pizza. Okay, great. And I want you to cover the right ear.
Pasta.
Pasta. Good. Very good. Not from Olive Garden.
Not from the Olive Garden.
Okay. Great. So Marco's cranial nerve 8, auditory cranial nerve, is also intact. You know what, Marco, when I was checking your neck, I forgot to check function of your neck muscles functioning well, and that's accessory muscle, cranial nerve 11. So you were able to move your head to the right and to the left without any difficulty. Your range of motion was great. I just want you to kind of push against my hands. Oh, yeah, he's strong. Any problems with that? No. Okay, so you're able to shrug your shoulders against resistance. Very good. Wonderful. Okay, next, Marco, I'm just going to take a look inside your mouth. But before I do that, I'm looking at your lips. They are pink and moist. Beautiful. Open your mouth. I'm looking at your tongue, pink and moist. Your buccal mucosa, pink and moist. Your hard palate is white with transverse rugae. Your soft palate, pink and moist. You could say, uvula, midline, wonderful. Okay, your pharynx, pink and moist. Tonsils, you don't have tonsils anymore. Okay, and your teeth, you have all your teeth.
So far.
That's great. That's great. He doesn't wear dentures. Okay, yeah. Your gums are in great condition also. So Marco, thank you so much for doing this little quick assessment with me. Thank you for bringing in your therapy dogs
My comfort dogs.
Your comfort dogs. They fell asleep. Oh no, one of them just woke up. So thank you very much. Is there anything else I can get you before you leave today?
No.
Okay. Thank you, sir. Bye.